testing across the United States. Preliminary results appear to show that most Americans have not been infected with the virus and are still vulnerable to the infection, serious illness, and death. We hope to be able to post the analysis of the first round of this study in the next several weeks. As I've stated before, the CDC...
Yes, it is. That's absolutely correct.
Now, millions of students are going back to thousands of colleges, and there are inevitably outbreaks of COVID-19, Dr. Fauci. Is the smart thing for college administrators to do is to send those college students home when the outbreaks occur on campus?
Absolutely not, Mr. Chairman. They should be able to accommodate the students in a facility, maybe a separate dorm or a separate floor, so they don't spread among the student body, but do not send them home to their community because of the likelihood of then reseeding infection in a community.
Dr. Fauci, I've listened to your testimony for the last, has been exposed to COVID-19. What about the American population? How many of us have been infected by COVID-19?
Thank you, Mr. Chairman. CDC is in the process of a very large sequential study across the entire United States measuring serology. As I mentioned, the preliminary results in the first round show that a majority of our nation, more than 90% of the population, remains susceptible. It varies in different geographic parts from states that have less than 1%.
Said is that the original guidance that was published by the CDC with the approval of Dr. Redfield and the senior scientist did not, unequivocally, it did not recommend against testing asymptomatic individuals. In fact, there were multiple sentences that said it is important to test asymptomatic individuals, but in certain circumstances, it's important to do that within the context of public health or medical supervision. That's all it said. It was widely misinterpreted. It was widely
This is a significant red flag. So here is my question to you. If I want the best guidance on the latest science so I can protect myself and my family, can I trust CDC's website to give me that information?
Yes, I'm going to say again that my agency and myself were committed to data and science and to give the American public the best public health recommendations we can based on that data and science, and be open, if necessary, if the data and science changes, to modify that guidance based on that new data. But we are committed to data and science, and that will be the grounding of how we make these recommendations.
Starting with Dr. Fauci.
Thank you for the question, Senator Casey. Yes, I've said that in the past, that if a vaccine that's shown to be and proven to be and authorized by the FDA to be safe and effective, I certainly would take that vaccine, and I would recommend to my family that they take that vaccine. Yes.
Thank you.